I just leave the sack alone. I mean, why put something else back in there? It
Well,
just
I mean,
gets
it
in the
would
way.
be, yeah.
I mean, it's not like any woman ever looks down there and goes, God, he's got great balls. Like said no woman ever in
for
history.
the record, no one cares about the balls. Just
Are we recording our audio
care.
yet? Or are you sure? Oh, yeah. Okay, this is great.
Yeah, no woman ever cares about the balls. They're not good. They're not bad.
So much good stuff already.
Yeah, exactly. I'll take things women really don't care about for 600, Alex.
What is balls?
What are the testicles?
Okay, great.
Welcome to Balls Deep, a humorous yet informative medical show with a mission of optimizing your performance in the bedroom, the bathroom, and the boardroom. I'm your host, Dr. Joe Pizzona, a board-certified urologist and CEO of Pizzona MD. We hope you enjoy. Now, let's jump right in. Hey, Stream Team, Dr. Joe Pizzona. Welcome back to another episode of Balls Deep. I am here with a familiar face who has been in absentia. Is that a word?
Absentia.
Absentia, whatever.
So close, but so far.
You know,
I was gone.
You were.
I was gone, but I'm back.
Yes, you are.
But I'm injured.
Yes, tell everyone what happened.
So I have had a foot surgery almost 2 weeks ago, and my mood has been poor. I have misbehaved and have been in a lot of frustration, but I am making it.
I think you've been great. I mean, in all seriousness,
I gave him $20 to say that.
No. In all fairness, like I went to this with pretty low expectations. And
Yikes!
You, number one, you have outstanding balance. Like you've been hopping around on one leg like ridiculous. So,
thank you, ballet.
Mark, you're doing a great job with your training. Keep it up. That wasn't ballet. Come on, that's all your training.
It's a lot of balance, but yeah.
But no, I mean, I haven't asked for any Xanax myself, so I mean, I think you've been pretty good.
We're doing okay.
Yeah,
we're here. We're making it.
We made it. I mean, we had a couple guests in your absence.
Heard about that.
Yes.
Don't give my job away.
I won't. Don't
Okay.
worry. You're too lovely, and I have to come home to you, so I'm smart enough to.
Very true.
Balls deep.
So with return, what should we talk about today, Kat?
Well, the subject of ball pain, I think the medically correct term would be testicular pain.
Well inspired by all the foot pain you've been suffering with for a couple weeks. So let's.
I'm going to be really honest. You guys may have some pain in that area. This is worse, but we'll talk about it. We'll talk about it.
You don't have nuts, so you don't know that for certain.
I do not have nuts. That is an
good.
accurate statement. Thank you, Dr. Pizzona. So yeah, I want to talk about testicular pain today.
Well, this is something that, it's funny. I don't think anyone in medical school is like, oh, God, what's the sort of stuff I want to take care of? And like, I really want to help nut pain, right? Like said no doctor ever.
Odd choice.
We go into urology because we play with cool lasers and robots and we help cure cancers. And then you get out into real practice and like half the guys you see have achy balls. And it's not to make light of it. It's just, it's a very big problem actually. And it causes these guys a lot of suffering. And I think there's a lot of misinformation about it. And, I think we do a real good job at our practice of managing it and helping folks out. So I thought, hey, why not help all of you and spread the word about, if you have achy nuts, what should you do about it?
Okay.
Well, what questions do you have? Come on, let's go.
I have a lot of. See, you can see I've been gone a couple weeks. I'm rusty. Completely rusty. Okay, so if we're going to talk about ball pain, which I'm pretty sure is not the medically correct terminology, what would be different causes of testicular pain? How would one arrive at this pain other than just being in a bar fight and getting a good swift kick?
Well, first off, it is the correct medical term. You can look it up in the textbooks.
Ball
pain, absolutely.
I don't think that's true. Okay.
So yes, this is not talking about the more common scenario of a bar fight, but more I'm running around the house and so's my toddler and head goes right into the groin. So lots of little ones are right at that height. Any dad out there has taken a few nut shots. And if you're in a fraternity. So, most guys come in and obviously they are it's college. You kind of like like back in the day, lob like a cell phone up in the air and see if you could land it in a guy's crotch. Like women didn't do that.
Who are you? No,
I'm a guy.
no, women don't do this.
We're idiots.
Yeah,
I mean, that's the sort of stuff we do.
True.
And that was sober.
God.
So what causes testicular pain? So most people think that most pain is due to infections, right? That's hands down. These guys get diagnosed with, quote, epididymitis or prostatitis. It's an infection. We do an exam, you're tender, here's some antibiotics, get out the door. Like, that's how most people manage this. When in reality, probably about 99% of the guys we see have muscle or nerve related pain. So, let's make some analogies. When most people have headaches, you don't have a brain tumor, okay? When most people have backaches, you don't need to see the spine surgeon and get your back operated on. Well, most of the time we see guys for testicular pain, it's not because there's something bad going on. It's muscles and nerves. Well, how the heck does that happen? So always helps to go back and understand some of the anatomy. So our testicles actually start up by our kidneys. And when we are developing in our moms, they descend down, they pop out in the groin area, and then they kind of go down into the ball sack. And that's another medical term. You could look it up.
Yeah.
Or scrotum if you prefer.
Okay.
As it pops out kind of down this groin area, it grabs all the layers of our abdominal wall. So you've got skin, you've got what's called fascia, which is kind of a layer of strength tissue. You have muscles, and then you have the lining of our abdominal cavity. So the scrotum actually has all of those layers. So you have muscles in the scrotum, and then you also have a muscle that wraps around what's called the spermatic cord. That's all the stuff that dangles above the testicle and kind of holds it in place. And it's got blood vessels. It has nerves. It has the vas deferens, the tube we work on for vasectomy. And it's got these muscle fibers. And these muscle fibers actually start up in our core. So we think of our abdominal muscles, our rectus, the six-pack for the very few people who have those. And then you have what's called the oblique muscles. So the internal oblique muscle becomes what's called the cremaster muscle. And this is the muscle that every guy knows because you've gotten into cold water. And what happens to those balls? They pull on up. Okay, they retract up. And then when it's warm out, they relax.
I think there was a good Seinfeld episode about that.
Yeah, it was a scared turtle, right?
Is that it? Yeah.
Well, yeah, certainly the penis does shrink a little bit in cold water as well. But, let's be honest, it doesn't shrink that much. But the testicles absolutely sort of move up and down. So let's think about it. For guys who are sitting, guys who are maybe lifting too heavy weights, guys who maybe don't stretch,
That's you.
Yeah, this guy.
That is you.
It makes sense that as our core stabilizes us for walking, for sitting, for all of our movement, that at some point, especially as we get older, those muscles are going to get irritated. And so for some guys, instead of getting a headache, a neck strain, or a backache, they get testicle pain because all those muscle fibers are irritated. So this is one of those things that they really actually didn't teach us in urology residency. They don't teach most doctors, but yet it's hands down the number one cause of testicular pain. No one talks about it, and then we just ignore it. We tell guys, that's in your head. No, the guy's really feeling the pain. I mean, these muscle fibers are irritated. It hurts, but it's just not cancer. It's not an infection, and it doesn't require antibiotics.
So often what you're saying is a lot of this testicular pain is really more to do with torquing a muscle, just tweaking, so like you would do your back, like you were just saying.
Yeah.
And it's not due to anything that's really, really concerning, but how would you know the difference?
Great question, right? So the key is going in and getting an evaluation with a good urologist who knows how to look for this. And, again, as I alluded to earlier, unfortunately, most of my colleagues are too busy or too lazy or too old school and don't want to change their ways, that it's honestly easier, rather than explain everything I just explained to you in the audience, it's frankly easier to be like, okay, here's some doxycycline, take this and it'll probably go away, and call me if it doesn't.
Even if it probably has nothing to do with an infection.
Correct. And why? Because first off, it's going to probably get better on its own anyway.
Okay.
Number two, you prescribe some antibiotics that, although are not great overall, not going to cause too much harm. And, there's a placebo effect. If I give you a sugar pill and say, this is going to help you, you're going to feel better. And if the reason your ball hurts is because you are tense and you're stressed and you're worried about something bad, and I go, whew, God, it's just a little infection. All I got to take is this antibiotic. Pain's going to get better on its own. And that's often what happens. Or it doesn't. And then the guy keeps going back. Eventually the urologist pushes them to the side. They get pissed off and then they come find us. So your question was, how do you know it's this? Well, it's really a diagnosis of exclusion, which is a concept in healthcare that we have to rule out the bad stuff such that we can then presume this is the cause. Because I don't have a test to prove this. Just like a neurologist doesn't have a test to check that this pain you're feeling right here every day at 4 p.m. when your kids get home and, your husband's late from work and dinner's not ready, that it's just a tension headache, right?
Right.
We can't prove it. So we got to rule out other things. So we do a good history to see if it's consistent with a muscle pain. So muscle pains tend to alternate. Right? So if a guy comes in, he's like, well, my right ball hurt last week, but now my left's really hurting. Cancer and infections and twisting don't do that. If it tends to be short-lived, couple seconds. Again, these bad things tend to be like, no, it's been aching for days nonstop. We look for other symptoms, so infections are going to have fevers. Maybe it started with a UTI, get some burning with urination. If you've got a twisted testicle, you could be sick to your stomach, throwing up. So there's other symptoms someone's going to complain of.
So that's something that I heard about from you that I'd never heard about before, a twisted testicle, which is kind of a really bad thing.
Yeah.
What is this? How would this occur? And then what would you do?
Yeah. So this is one of the few emergencies that'll get a urologist out of bed. So first and foremost,
this is legitimate scary ball pain.
Oh, absolutely. So now let me reassure everyone who's watching this that they're going, my ball's starting to hurt a little bit. Like, do I got to stop this video and go run in? No. So first off, age. It is relatively rare, although not unheard of, after the age of 18. This tends to be
after the age of 18.
This tends to be a child or teenage or at least young 20s sort of thing.
Okay.
You don't see this in 40-year-old guys. Like, it's just pretty damn rare. If it was going to happen, it was going to happen before then. So that's number one. Number two, it is knock you to your knees. You're nauseated. You're doubled over. It is not just a guy who got a nut punch sort of feeling. It is 10 times worse than that. Often you're going to get some swelling of that area, and then on an exam, we can do an exam and an ultrasound and sort of rule it out. So if you ever get like this is really awful pain and I've never had anything this bad, I'm getting sick to my stomach, go to an ER, get an ultrasound, and they can rule in or rule out torsion by seeing, is there blood flow? So essentially what is torsion? It's a twisted testicle. So if we go back to the anatomy earlier, we said it dangled from that spermatic cord. Well, if you got the ball hanging here and you got the cord, it's kind of like I don't know, like a jingle bell, right? I mean, just sort of like an ornament hanging.
Okay, good analogy.
I'm making some stuff.
Just make it up.
Making some shit up on the run here. So it's kind of dangling down there, right? A little door knocker. And if it's not well attached to the scrotum underneath to hold it in place and it's just literally dangling by this, you can imagine how it could kind of twist on itself.
I can see that.
And so when it twists, the blood supply stops to the testicle, and we'd catch that in an ultrasound. So the reason it hurts, your nut's literally dying. And you got about a 4-hour time window before that ball is dead and black and no longer salvageable. So that's why it's a very time-sensitive issue. So again, usually not subtle. This is not your husband complaining his ball aches a little bit.
Okay.
This is pretty obvious stuff.
Okay. Go back for just a second to the muscle pain, which you say is kind of the majority of ball pain, the muscle and the nerve issues. But did you tell us, what would you do? What do you do to take care of the muscle and the nerve pain?
So
obviously you don't want an antibiotic. That's not something that's going to help that. So for muscular pain, what's the remedy?
So first and foremost, again, diagnosis of exclusion, meaning you got to go see a urologist or someone who knows what they're talking about and rule out other things. Number two, it's reassurance. And then we start with just sort of some conservative therapies. And again, it varies from patient to patient. I saw a huge uptick in ball pain during COVID. because guys were just literally hunched over at a desk all day, right? And so you imagine you're not working out your core, your posture's gone to crap. You're going to, get some muscle imbalances and it's going to get irritated. That's very different than the guy who's like deadlifting all the time and just lifting way too much weight. Okay. Different than the guy who really is suffering from bad anxiety and just every muscle in that guy's body is crazy tight. Depending upon what the etiology is going to determine a little bit some of the recommendations. But in general, it's, Tylenol, ibuprofen, heat packs versus ice packs, whatever feels better. Sometimes changes in underwear. Some guys like loosey-goosey, let the boys hang and dangle. Other guys like more tight and support, so they're not dangling as much. And then really working with a skilled pelvic physical therapist. So we've got a friend, Tyler, who does physical therapy and specializes in this. And it's the physical therapists who aren't going to help you if your foot needs a little rehab or your knee. They understand the pelvis and all the muscles going here. So it's a level of training that's a little bit more nuanced and subtle. So you got to see someone who's really good at taking care of these folks, but they can work miracles. So that's typically what we're going to do. And then well beyond the point of this episode, we could do a deeper dive into this, and maybe I'll get one of my friends who are experts. We can start doing nerve blocks. We can do off-label medications. We could sometimes have to do surgeries to fix it. So there's certainly guys who are listening going, dude, I tried all that. This is BS. There are other things that can be done, but that's like a really small subset here. So again, I want to focus on what can the large majority of guys do when they have this come and go.
So we've been through a couple of different things, muscular, the torsion, but how would you know if ball pain was indicative of something that was really, really serious? Could ball pain ever be indicative of a cancer? Yeah. Everybody's terrified of the big C. Is that ever a correlation?
So traditionally speaking, testicular cancer is a painless, firm mass of the testicle itself.
And painless.
Typically painless. Okay. Now, that being said, I mean, again,
nothing's 100%.
Nothing's 100%. I'm constantly humbled. I saw a patient recently, probably a few months back, and he came in 2 to 3 days after a pretty good onset of pretty severe pain. Mm-hmm. And I examined him and he was exquisitely tender. The testicle was swollen. And I'm like, you've got an infection. This is just pretty clear. I mean, came on all of a sudden, wasn't there before, didn't feel a mass before. I'm like, listen, I don't know with certainty, but let's give you some antibiotics. Let's see you back in about a month. We'll repeat an ultrasound. I'm almost positive this is going to go away and that's all this is. Well, he comes back, saw one of our other team members, and the pain was a little bit better, but still hurting, and the mass was still there. Mm. And she rightly ordered what's called some tumor markers, a repeat ultrasound, and these tumor markers for testicular cancer were elevated. And this guy ended up having cancer. So again, I don't want everyone freaking out who's had achy testicles thinking they've got ball cancer, but traditionally speaking, testicular cancer does not cause pain. Traditionally speaking, testicular cancer is going to happen before the age of 40 and typically before the age of 30, but there's always exceptions to the rule.
Okay. Anything else you want to add to this long discussion about ball pain that I knew nothing about? I really thought that anytime guys talked about ball pain, it was literally because somebody punched him in the nuts. I mean, I guess that's not fair coming from a woman, but I did not realize that there were all these reasons for pain in that area.
Yeah, you thought guys were just wusses and whiny,
yeah,
but no,
is it
this
pain
is legit.
Or are you just kind of a pussy? I don't know. Can I say that word on here? Maybe not.
No, I mean, listen, I don't mean to joke about this, and neither do you, of course. I mean, this really affects some guy's life. I mean, this really can be debilitating, and there's always the outliers who have to go real far down the rabbit hole in the algorithm to get help. The large majority of guys who have this, it's a temporary thing. They need the reassurance. And once they understand what the root cause is, how it's a muscle and nerve issue, they can start making those adjustments and work with that pelvic physical therapist. Because as I tell them, listen, man, I'm a testicular expert, right? I'm not a muscle expert. So I've ruled out the bad stuff. Now I need to get you in front of the guy who knows how to work all of those muscles to get this better. So I think that's one key message I want people leaving with, is that we're not, we like having fun on this show, of course, because let's be honest, most medical shows are just boring. But it doesn't mean we don't treat people with respect or understand, like, this is a real issue that bothers people. But go see your urologist. If you do have an infection, which typically, again, is more pinpoint tenderness, swelling on examination. Like when I examine guys with an infection, it's not subtle. Like I can just tell they have an infection. I'll, of course, give them a course of antibiotics. So it's still a very common cause of pain. But if you've had antibiotic after antibiotic, you can keep doing the same thing over and over again, but you're not going to get different results, right? So maybe we got to pivot and look at something different.
Okay. Well, personally, I have learned a lot today.
Yeah.
So maybe we should throw it into my favorite part of the episode. Just the tip. So what did we learn today about testicular pain? Number one, most testicular pain is caused from irritated muscles and nerves. Number two, serious cases of testicular pain include torsion or twisting of the testicle and infections. Number three, please seek immediate medical attention if the pain is severe and associated with other symptoms. And lastly, testicular cancer does not cause pain, but when in doubt, please get checked out by your urologist.
Yeah, you're a little out of practice.
Oh, wow. I'm really out of practice. What kind of job do you do again? A urologist.
You're not even...
I'm going to get fired.
You're not even narked up on any pain medicines anymore.
I'm not. They didn't give me that many.
Yeah.
I thought I was really going to be happily loopy for a lot longer than I was.
Yeah, no.
So now I'm just, here.
I was hoping for some good outtake material that we could share with Chad, but unfortunately,
no.
There wasn't.
No.
You were just drugged up. So
I was just, Wow.
Well, hopefully this talk of ball pain has distracted you from your foot here, Kat. Thank you for coming on back. And Stream Team, thanks to you. Please, we'd love to hear from you. So please leave some comments on your favorite platform. We'd really love a 5-star review to get a Balls Deep out there to the masses. Listen, we're about having fun, but we're also about helping people. We want this to be a great resource for you. There's a lot of misinformation out there, whether it's about testicular pain or other conditions. So, ask us your questions and we'd love to help. So with that, please remember to show yourself a little bit more love and kindness. These are opportunities for improvement when we make mistakes. I don't think I got that right, but who cares?
That's okay.
You got the message.
It's messy today, but it's messy and we're fun.
Well, I've been up since 3, so...
that's your excuse. I don't even have one.
She's not sleeping, so I'm not sleeping. So whatever the hell I normally say, just follow that instead. But no, in all seriousness, guys, thanks for this. It was a lot of fun, Kat.
We're going to do better next time.
Well, maybe not, because we're going to do back-to-back. You ready for another one?
Yeah, I'm going to get a drink. It's okay.
All right, sounds good. All right, Stream Team, see you later.
Thank you for listening to this week's episode of Balls Deep. If you'd like to join our Stream team of listeners, please click the subscribe button on your favorite podcast platform. For more information about our practice, Pizzona MD, please visit pizzonamd.com. This podcast is for informational purposes only, and the content is not intended to be a substitute for professional medical advice. The show does not constitute the practice of medicine. No doctor-patient relationship is formed through this podcast or any of the social media channels related to this show. The use of this information is at the user's own risk. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.
You guys need more water?
No drugs.
The Drew guys.
I don't have drugs.
Come on.
Sorry.